Good morning. Welcome to the first national, could be international if you count 4 nations as separate, conference on accreditation, striving for excellence. I'm David Coates. I chair the Accreditation Committee. I've been involved in accreditation for more years than my boss cares to remember. And what I'm going to do is introduce all of this with a little bit of history, a little bit of background, before we move to the main bit of the morning, which is to talk about the good practice that has come out of developing curricula across the UK in the past few years. So the agenda is me talking, and then it's Robert Slater who's going to do a roundup of accreditation events and good practice. And then we have a series of presentations from different universities to share what we found going around doing these meetings that we felt was great ways of doing things, and we've invited them to come and talk to us about them. And that's really the heart of today. It's about sharing that practice, letting other people see what can be done and how it can be done, and driving up the standards and the experience of students through that process. This afternoon is much more interactive. So we started the first accreditation process just over 5 years ago, which is advanced accreditation. We'll talk a bit about it in a moment. But it's time to review how we've done all of that. And it's time to review the criteria that we use for the more general accreditation, which is the one that came in 2014. So that we can keep up with what it is that employees are looking for, what it is that students are looking for. And what we want you to do this afternoon is to help us with a couple of issues where we think change is required, and we really want your input into that. So that'll be this afternoon. I will get this to work. So I'm doing a welcome. Accreditation came about because in the early 2000s there was a whole series of reports about the poor quality of bioscience graduates. And in particular they were reports from companies who used bioscience graduates as researchers, the biopharmaceutical industry. And they were complaining of a skills gap, that effectively students knew a lot, but they didn't know what to do with it. And when they were going into either contract research organisations or pharmaceutical organisations, they had to be retrained pretty much from scratch. So there was a lot of discussion about, well, they don't know how to make up a solution, they don't know what a lab looks like, they really don't know what they do. There are reasons why bioscience developed like that over the 10 or 15 years before that, but the problem was that it was felt that we were producing degrees and graduates who were not fit for the employment market. And because that was focused initially on the research skills of students, we designed, set up and implemented what we now call advanced accreditation. We had a couple of years of consultation, in particular with the heads of university biosciences, with groups of people that we brought in from learning societies, and with a lot of help from the government, who were very keen for this to work. We did a pilot program in 2012 and allowed for a launch in 2012 for advanced accreditation for degrees that not only took you through those years to the English level 7, 6, but also included a period of practice, included a period of time where the students had to use what they'd learned, had to develop the skills of not only having the knowledge, but using it. In our discussions originally about that, the heads of university biosciences were very positive in helping to do that, but they did say this is only going to work for some universities. What we also need is something that works for every university at the undergraduate level. So once we learned how to do it with advanced accreditation, we developed what's now accreditation, that I will keep insisting on calling general accreditation just because it scans better, which is for bachelor's programs, bachelor's with honours, that focuses less perhaps on the research skills, but more on the employability and the use of biology skills. That was trialled in 2014, launched in 2015, and many of you in your institutions have chosen to go through that process. So we now have actually a whole series of accreditations. There's accreditation, which is independent, rigorous. It's a solid academic foundation, but in particular prepares graduates for the needs of employers. Advanced accreditation is a much more peer-review process that's looking for graduates who can be research-ready in laboratories, who have the practice, the experience of doing it. And of course, advanced accreditation is at the master's level, because it's either through an integrated master's or it's through a year in industry that's equivalent to that level. And the consequence of that was that we also had to develop standalone master's accreditation, so that we now accredit programs that are one-year programs, but still based around the research needs of the community, based on the advanced accreditation. More recently, we've developed two more levels. And these get developed because the community comes to us and says, we need something like this. Doctoral training accreditation is about looking at the training, not the research, but the training that students undergo, usually during their first year of PhD studies. And it's a response to the contraction in doctoral training centres, which are very heavily reviewed before funding comes to them, but to allow other universities, other groups to put together doctoral training programs that can be shown to be of equivalent standard. So it's a means of external review and validation and accreditation of those independent doctoral programs. And foundation degree accreditation is looking at the other end of the scale for us, for foundation degrees where there's a significant demand, both from universities and colleges of further higher education, because there's a gap in the market there in terms of who's looking at what where. So we've been developing different routes to accreditation. We go to the advertising bit now. So 48 UK institutions accredited in some form. That's about a third, coming up to a half, of the institutions that could be accredited in the UK. In addition to that, we started doing international accreditation because we got asked several years ago to be able to go out and look at, in the main research active, but also general accreditation, in universities abroad who wanted to say that their standards were up to, their programs followed the UK example for an undergraduate program in biosciences. So the new ones, the doctoral training accreditation, which we launched this year, and foundation, or last year, and foundation this year. And they've both been through the pilot stage already. Hopefully you know what the benefits are for everybody. We think everybody wins out of accreditation. Students are getting degrees that have been very much focused on what employers want. That means the employers should be able to see that these students are worth interviewing, worth employing. And in Scotland, certainly, we have anecdotal evidence that it's making a difference in terms of the career prospects of graduates from accredited universities. Higher education institutes get a recognition, not just of academic quality, but of the form of curriculum that's taking place, that's addressing the needs that the external bodies who press universities about employability. It's good evidence for them that the universities are following that. It's good for recruitment. And for us, the important part of it is the mechanism to drive change. When we were setting up accreditation, we had lots of debates about, we didn't want this to be a tick box exercise. We wanted this to be something that was a benefit to both sides of the table, not just about us judging, but us taking good practice and being able to share it across the UK. So this is, look for yourself in there. If you're not there, ask yourselves why not. 38 universities. We have master's accredited universities, foundation degree now. The doctoral and foundation degree were both the pilot projects. And we have international. The international is very interesting because the University of Ghana, which was the first to ask for formal accreditation, was doing it because it had to show the World Bank that it spent its money wisely. The World Bank gave the University of Ghana a lot of money to set up a local African centre of excellence. And, fairly rightly, they wanted to be able to say back to the World Bank, yes, the money is good. Especially as the World Bank set up quite a lot of African centres of excellence, all focused on issues in Africa, and teaching local students, training local doctors how to do that. And one of the most amazing things about doing that accreditation was the quality of the student experience in an environment where there might not be a lot of money, but where careful use of resource and the commitment of staff and students made a huge difference. And the programme we accredited there would stand up against any programme in the world. There's not many places that do that kind of visit, certainly in the biosciences. So we're getting more and more interest from universities across the world. And there's a team just off to Mexico soon to spread the word and spread our kind of structure and our kind of view of curriculum, because they recognise that it's a very good one. So that's the introduction and a bit of advertising. What I'm going to do now is hand over to Robert Slater, who has led, I'm sure he'll tell you how many, from the general accreditations, and tell you a little bit about what we see in best practice there.